We have finished module 4, where we look at malignant primary tumor of the heart. We're going to briefly, in module number 5, to look at PET imaging. We're not going to spend too much time talking about it, but PET is an adjunct imaging that is important for staging the cardiac tumors. Now, PET stands for positron emission tomography. It utilizes a FDG as a tracers that will decay. The F18 will decay and picked up by the positron emission tomography. The organic moiety is essentially a glucose analog, so therefore it is a metabolic imaging where the glucose goes to where the activity is for metabolic activity is. Now, we don't do PET per se to try to work out the cell types or the different differentiations that we talked about for tumor. What we really use it for is to look for extracardiac metastasis, or in lymphoma's case, we'll be looking for extracardiac origins of lymphoma. Okay. It is typically less useful for differentiating benign versus malignant tumor because some of the benign tumor will be pretty avidly vascular. So in that case, at least some of the radio tracers will accumulate in a benign mass, so it could be pretty bright. Now, there are two technologies that's now being used. First, a much more common one, PET-CT. Some of these CT components of these scanners actually have cardiac imaging capability, as we described earlier. So for this kinds of scanner, it is possible for us to do concomitant anatomic characterization of the cardiac tumor while we use the PET parts to survey the entire body for metastatic disease. A new generation of scanner now combines MRI with the PET scanner. Now, this is really useful because, in principle, if there's fully cardiac capability for the MRI side, you can go ahead and images all of the MR characteristics that we discussed using a standard protocol that I gave, and also in the same setting, try to do the PET study itself too. So in one-stop shop to get everything done.